Hello, how are you? Welcome to my channel, Sam the Stoic. Now, today we're going to read lists of medications divided by fields, but divided by health issues. So, let's start with analgesics, so painkillers, right? So we have two lists, actually three lists: opioids, cocodamol, cocodaprin, codeine, codidramol, coproxamol, diamorphine, heroin, so diamorphine is heroin, dipipanone, fentanyl, meptazinol, methadone, morphine, pentazocine. It's written pentazocine, C-I-N-E, pethidine, phenazocine, tramadol. So this list was the opioids. Then there is the list of NSAIDs: aspirin, diclofenac, etodolac, fenbufen, phenoprofen, ibuprofen, indomethacin, ketoprofen, ketorolac, mefenamic acid, naproxen, piroxicam. Other non-opioids: nefopam, paracetamol. Okay guys, so this was the list of analgesics. Let's do this. Let's gonna read it again. Okay, cocodamol, say that again. Cocodaprin, say that again. Codeine, say that again. Actually, I want you to say what is it. Okay, so codidramol is an analgesics. Okay, coproxamol is an analgesic. Diamorphine, heroin, is an analgesic. Anyway, dipipanone, say that again. Dipipanone, fentanyl, meptazinol, methadone, morphine, pentazocine, pethidine. You see, I'm giving little space so you can say it. Phenazocine, tramadol. This was the list of opioids. Then NSAIDs, which stands for I don't know. Aspirin, say that again. Aspirin, diclofenac, etodolac, fenbufen, phenoprofen, ibuprofen, indomethacin, ketoprofen, ketorolac, mefenamic acid, naproxen, piroxicam. Other non-opioids. Nefopam, paracetamol. There you go. Then we have the sleeping drugs, common drugs. Sleeping drugs, remember, benzodiazepines. So we have like 4 fields inside the sleeping drugs. There's no many medicine to remember. These are the common drugs, okay? So we have benzodiazepines: loprazolam, lormetazepam, nitrazepam, temazepam. So I'm going to repeat it. You have to repeat it with me. Loprazolam, lormetazepam, nitrazepam, temazepam. What is it? Sleeping drug. And it belongs to benzodiazepines, which is not important. But then we have the barbiturate. I would say, I don't know, is it pronounced barbiturate or barbiturate? Anyway, amylobarbitone. Say that again. Amylobarbitone. Say that again. Perfect. Then chloral derivates. derivatives. Chloral betaine, chloral hydrate. Say that again. Chloral betaine, chloral hydrate. Then we have the other non-benzodiazepine sleeping drugs. Chlormethiazole. Say that again. Zolpidem, Zopiclone. Those were sleeping drugs. Then we have anti-anxiety drugs. Okay, so common drugs, benzodiazepines. Anyway, what does it mean, benzodiazepine? We could ask our friend here, right? Benzodiazepine meaning, and he's gonna tell us. My friend is my best friend, actually, ChatGPT. Benzodiazepines, often referred to as benzos. I'm sure in America they call them benzos, not in UK. No, I'm not sure. Maybe they call it even in UK benzos. I don't know. Are a class of psychoactive drugs commonly prescribed to treat conditions such as anxiety, insomnia, seizures, and so psychoactive drugs. They work by enhancing the effect of a neurotransmitter called gamma aminobutyric acid. Sorry for my pronunciations. GABA. How do you say? Anyway, in the brain. So let me say that again. They work by enhancing the effect of a neurotransmitter called gamma aminobutyric acid, GABA, in the brain, which has a calming effect on the nervous system. Benzodiazepines are known for their sedative, muscle relaxant, anti-anxiety, and anticonvulsant properties. Common examples include drugs like diazepam, Valium, lorazepam, Ativan. So diazepam, and then in brackets it's a Valium. Lorazepam, in brackets Ativan, and alprazolam, in brackets Xanax. While effective for short-term use, benzodiazepines can be habit-forming and are often associated with dependence and withdrawal issues if used long-term or in high doses. Okay, guys? So we were saying that anti-anxiety drugs, benzodiazepines, chlordiazepoxide or chlordiazepoxide probably. And so repeat again. Chlordiazepoxide. Your turn. Diazepam, lorazepam, oxazepam. So these are anti-anxiety drugs which are benzodiazepines. Then we have the beta blockers, which means, what does it mean, beta blockers or beta blockers? I love the I can't even say. Anyway, beta blockers, also known as beta adrenergic blocking agents, are a class of medications that reduce blood pressure by blocking the effects of the hormone epinephrine, adrenaline, on the body's beta receptors. These receptors are found in the heart and blood vessels. When beta blockers or beta blockers block these receptors, they slow down the heart rate, reduce the heart's workload, and lower blood pressure. These can help treat conditions like hypertension, which is high blood pressure, also known as blood pressure, angina, chest pain, which is chest pain. I mean, it's not which is, but you might know it as chest pain. Heart arrhythmias, in brackets irregular heartbeats, heart failure, or after a heart attack, in brackets to prevent future episodes. Beta blockers are also sometimes used to treat migraines, anxiety, and certain types of tremors. Some common beta blockers include metoprolol, propranolol, and atenolol. Atenolol. Because they affect the heart and blood vessels, beta blockers are often prescribed for cardiovascular condition, but can also be used for non-cardiac issues like controlling symptoms of anxiety. Okay, guys, so I was going to say the other non-benzodiazepines, and we are still in the anti-anxiety drugs. Buspirone or buspirone. Say it again. Zolpidem. Your turn. Zopiclone. Your turn. Okay, let's read them again. So common drugs of the anti-anxiety drugs. Benzodiazepines, we have 4. Chlordiazepoxide, diazepam, lorazepam, oxazepam. Now it's your turn. You say them, the 4 of them. Chlordia, diazepam, lorazepam, oxazepam. So I'm going to say them again. Chlordiazepoxide, diazepam, lorazepam, oxazepam. Okay, so now I say to you, repeat it. Chlordiazepoxide, diazepam, lorazepam, oxazepam. Beta blockers, still anti-anxiety drugs. Atenolol, oxprenolol, propranolol. Then still anti-anxiety drugs, other non-benzodiazepines. Buspirone, Zolpidem, Zopiclone. No, maybe C part. Now, no, I'm just finding out that here it says C part 4. Don't tell me that this is just the first, that there's a lot of more medication. I don't want to hear it. What do you mean C part 4? Let me stop it right here. 1 second, guys, sorry. Anyway, let's just go forward and who cares. Then we have antidepressant drugs. Okay, guys, so we have common drugs. Now, first field of the common drugs, SSRIs, which means, let's ask, what does it mean, SSRIs, as a group of medicines? SSRIs, or selective serotonin reuptake inhibitors, are a class of medications primarily used to treat depression and other mental health conditions. They work by increasing the levels of serotonin, a neurotransmitter in the brain that helps regulate mood, emotion, and anxiety. SSRIs block the reuptake. So reuptake means reabsorption of serotonin into neurons, making more serotonin available in the brain, which can help improve mood and reduce anxiety. SSRIs are commonly prescribed for depression, anxiety disorders, such as generalized anxiety disorder or panic disorder, obsessive compulsive disorder, OCD, post-traumatic stress disorder, PTSD, social anxiety disorder, premenstrual dysphoric disorder, PMDD. Examples of SSRIs include fluoxetine, Prozac, which is Prozac, sertraline, Zoloft, citalopram, Celexa, escitalopram, which is Lexapro, paroxetine, Paxil. So when I say that, okay, let me say it again so we can learn them. Okay, maybe, I don't know if they're gonna be here. No, they are here as well. So I say it, you repeat it. Fluoxetine, which is Prozac, or like Prozac. Say that again. Okay. Sertraline, like Zoloft. Citalopram, like Celexa. Escitalopram, like Lexapro. Paroxetine, like Paxil. Very good. SSRIs are generally considered safer than older classic of antidepressant and have fewer side effects, but they can still cause side effects like nausea, insomnia, and sexual dysfunction in some patients. They often take a few weeks to start showing their full effects. Okay, guys, then, so let's go back to the book. SSRIs, citalopram, your turn. Fluoxetine, fluvoxamine, paroxetine, sertraline. So remember, we're still in the antidepressant drugs. Say that again. Good. MAO so there are 4 fields, okay, in the common drugs, in the common antidepressant drugs. One was SSRIs, which was standing, I already forgot, for selective serotonin reuptake inhibitors. Okay, then there is, so SSRIs, then there is MAOIs, MAAOIs, then there are tricyclics and other drugs. So let's go to MAOIs, which is moclobemide. Say that again. What is it for? Antidepressant drug. Phenelzine, which is for antidepressant. Tranylcypromine, okay, or tranylcypromine. Say that again. Tranylcypromine, antidepressant drugs that belongs to the MAOIs group. MAOIs meaning, guardiamo qua, sorry, I was speaking in Italian. Let's see here. MAOIs or monoamine oxidase inhibitors. Monoamine oxidase inhibitors are a class of antidepressant medication that work by inhibiting the activity of an enzyme called monoamine oxidase or oxidase. I don't know how you pronounce it. This enzyme breaks down neurotransmitters such as serotonin, norepinephrine, I heard of that one, and dopamine, I heard many times of that one, in the brain. By inhibiting monoamine oxidase, MAOIs increase the levels of these neurotransmitters, which can help improve mood and alleviate symptoms of depression. Right? Let's go forward. So let's repeat together the MAOIs, which are antidepressant drugs. Say that again, because I know you're walking, you're distracted. Say that again. MAOIs are antidepressant drugs. They are the second field. The first one was SSRIs, which was, if I cannot remember now, how will I remember later? Anyway, which was, I'm gonna tell you, of course, selective serotonin reuptake inhibitors. Your turn. Selective serotonin reuptake inhibitors. Anyway, it's not very important. MAOIs are moclobemide, phenelzine, tranylcypromine. You repeat. Moclobemide, phenelzine, tranylcypromine or tranylcypromine. Then we have the tricyclics. Amitriptyline, this one is common. Amitriptyline, clomipramine, repeat. Then we have the dothepine, imipramine, lofepramine. So we're still in the antidepressant drug. Say that again, antidepressant drug. Then we have other drugs, maprotilene, mianserin or mianserin, nefazodone, trazodone, very common, you repeat, trazodone, venlafaxine, you repeat. Perfect. Then we have the antipsychotic drugs. Okay, so we have common drugs, phenothiazine. Guys, we are in the letter A. How am I supposed to go? Okay, let's do the letter A then. Phenothiazine antipsychotic. So we are in the antipsychotic drugs. We see the common drugs. We have 3 fields. Okay, so the first field is phenothiazine antipsychotics, chlorpromazine, flufenazine, you repeat, flufenazine, pipothiazine, thioridazine, trifluoperazine. Then we have another field called butyrophenone antipsychotics, and the first one is droperidol, haloperidol. Haloperidol is very, very common, and it is an antipsychotic drug. Other antipsychotics, clozapine, flupentixol, loxapine, olanzapine, pimozide, risperidone, very, very common, risperidone, sertindole, solpiride, zuclopentixol. Okay, guys, do you want? Then we have the antimanic drug, lithium. Okay. I hope that these are the most important, because at the end of this box it says always, at the end of every box it says C part 4. So I just hope that these were the most important, most common, but I'm not sure about that. So let's repeat the antipsychotic drugs. Common drugs: phenothiazine antipsychotics, chlorpromazine. So every time I say, you repeat. Then flufenazine, pipothiazine, thioridazine, or no, it's better to say thioridazine. It's less of a labyrinth of things. Okay, then trifluoperazine. Okay, then we have the butyrophenone antipsychotics, droperidol, haloperidol. Other antipsychotics, clozapine, flupentixol, loxapine, olanzapine, pimozide, risperidone, sertindole, sulpiride, zuclopentixol, and then we have antimanic drug, lithium. Now I have to give you a good news. When the book says C part 4, it doesn't mean that is not mentioning very important drug or the very common drug. The very common drugs are these one that I'm mentioning. It just means that that some of the medicines that are mentioned, that I've said, there's gonna be in part 4 for some of these ones that I've already mentioned. There's gonna be like an explanation. Okay, it doesn't mean that in the part 4 there are going to be medicine that have not been mentioned here. Just to be clear. Okay, guys. Then we have the anticonvulsant drugs. Okay, and we have here common drugs: carbamazepine. You repeat every time I say so. Carbamazepine. Clobazam. Clonazepam. Diazepam. This one is very common. Diazepam. So anticonvulsant drug. Diazepam, super common. At least in the world where I'm now, yeah, I've seen it many times. Ethosuxamide. Gabapentin. Gabapentin is, it's like everyone is on gabapentin, anticonvulsant drug. I thought it was the GABA, they also call it the GABA, they call it in the handover. Anticonvulsant drugs. So it's for, I think it's for epilepsy and stuff like that, right? Isolated convulsion, seldom require drug treatment, blah, blah. Yeah, anyway, they are anticonvulsant drugs, okay? Then we have, after gabapentin, we have lamotrigine, phenobarbital, phenytoin, piracetam, primidone, sodium valproate. This one also is very common. Sodium valproate, topiramate, vigabatrin or vigabatrin. Then we have drugs for Parkinsonism. Okay, drugs for Parkinsonism. Okay, actually, before going to the drugs, let's repeat the anticonvulsants. Maybe it's better if I repeat them every time. So, carbamazepine. For what is it? Anticonvulsant. Is an anticonvulsant drug. Clobazam, clonazepam, diazepam, ethosuxamide or ethosuxamide, gabapentin, very common, lamotrigine, or no, I don't think it's lamotrigine, no idea, phenobarbital, phenytoin, piracetam, primidone, sodium valproate, topiramate, vigabatrin. Then we have drugs for Parkinsonism. So we have anticholinergic drugs. So we have two fields for Parkinsonism: anticholinergic drugs and dopamine boosting drug. So let's go with the first. Yes, because exactly, I remember that Parkinson, it happens because the brain doesn't produce dopamine, I think, something like that. So anticholinergic drugs: benthexol, benztropine, biperidine or biperidine, orphenadrine, procyclidine. This one is quite common. Procyclidine. Let's repeat them together: benzexol, benztropine, biperidine or biperidine, orphenadrine, procyclidine. Then we have, still belonging to the Parkinsonism drugs, the dopamine boosting drugs, which are amantadine or amantadine. This one is common. Then we have apomorphine, bromocriptine, levodopa. This one is, I've seen it, levodopa, lisuride, pergolide or pergolide in Italian, sure it's pergolide, selegiline, or selegiline, no idea. Let's repeat them. The dopamine boosting drugs: amantadine, which is common, so you have to remember, repeat: amantadine, apomorphine, bromocriptine, levodopa, lisuride, pergolide, selegiline. Nervous system stimulants. Jesus, Jesus, it's gonna be a long thing, isn't it? So guys, what do you think if we finish it for today? Maybe, what do you think? Or let me see, or maybe no, I'll go forward, because this was like the brain and nervous system, and it's gonna end very soon. So let me do this last part. Okay, so we have the nervous system stimulants, which are respiratory stimulants: doxapram, you repeat, doxapram, nicethamide or nicethamide, theophylline with 2L, / aminophylline or theophylline aminophylline. Repeat, theo. So drugs for nervous system stimulants, okay? And the one I mentioned, are respiratory stimulants. So there are 3/4. The third is like together with the other, I think. So doxapram, nicethamide, theophylline, aminophylline. Then we have amphetamine, dexamphetamine, and then we have, oh sorry, the amphetamine was like a field, and belonging to this field there is the dexamphetamine. Repeat, which is for nervous system stimulant. So the dexamphetamine is a nervous system stimulant. Other drugs: caffeine. Bella, ma si può prendere così? Sorry, I was speaking Italian. Can you take a drug called caffeine, like in a box? It's like tablets of caffeine? Probably yes. Anyway, I'm already on it. Very much so. Then we have methylphenidate or methylphenidate. No, I don't think that they're gonna pronounce it like that. So methylphenidate. Then we have mepolin. So let's repeat: caffeine, methylphenidate, mepolin, which are drugs for the nervous system stimulant. Then we have drugs used for migraine. Common drugs, we have two fields for the migraine: drugs to prevent migraine, and then drugs to relieve migraine. So the drugs to prevent migraine, this is a quite nice division compared to the others where there was difficult names, and that's it. This one, they are quite understandable fields. So drugs to prevent migraine and drugs to relieve migraine. Yeah, very good. So amitriptyline, which we met before. So say that again: amitriptyline, which is a drug for migraine. So apparently this amitriptyline, which we have met before, must be also for something else, which I already forgot. But surely we met it, right? I already mentioned it. Do you remember? If you remember, just say it out loud so I can hear. I cannot hear you. Honestly, I cannot hear you. Why you're not saying it? Say it. Come on, son. No, I cannot find it. Anyway, I thought we met it, but honestly I cannot find it. So that means it's just for migraine. Is that possible? I thought we met it. No? Sorry guys. So amitriptyline, then we have clonidine or clonidine, cyproheptadine, cyproheptadine, methysergide or methysergide, nifedipine, pizotifen, propranolol. This one as well. Didn't I mention it before? Propranolol? I don't know. Verapamil or verapamil. Then we have the drugs to relieve migraine: aspirin, codeine, ergotamine. So codeine is quite strong. Codeine is almost control drug, I think. There must be some. It's like an opioid if I remember correctly. Is codeine an opioid, and how strong it is? Let's see what my friend has to say about it. So yes, codeine is an opioid. Okay, it is a naturally occurring substance found in the opium poppy plant, and like other opioids, it is used to treat mild to moderate pain and suppress cough. Codeine works by binding to opioid receptors in the brain and nervous system, which reduce the perception of pain and other. In terms of strength, codeine is considered a weak opioid. So I was wrong. A weak opioid, especially when compared to stronger opioids like morphine, oxycodone, or fentanyl. Codeine is often combined with other pain relievers such as acetaminophen, like Tylenol, in medications like Tylenol with codeine. When taken orally, a typical dose of codeine is around 30 milligrams, and its pain relieving strength is about 1/10 that of morphine. So codeine is equivalent of 1/10 of morphine. So it's considered quite a weak opioid. Because of its relatively lower potency, codeine is commonly prescribed for less severe pain or when over-the-counter pain relievers are insufficient. However, it still carries a risk of dependence, abuse, and side effects typical of opioids such as drowsiness, constipation, and nausea. So even though it's not very powerful, be careful because it can give you, you can become dependent of it. I knew. So codeine, then we've got ergotamine, then we've got paracetamol. That is the most common medication in the world, probably. And then we got sumatriptan. Okay, so let's read them again. The drugs to relieve migraine are aspirin, codeine, ergotamine, paracetamol, sumatriptan. What are they for? Drugs to relieve migraine. And what about the drugs to prevent migraine? Amitriptyline. What is it for? To prevent. Clonidine, cyproheptadine, methysergide, nifedipine, pizotifen, propranolol, verapamil. Okay, guys? Quanto è bello sto libro. How beautiful is this book, which I didn't consider for many days. Now I'm enjoying it because it's written quite little. Anyway, then we've got antiemetics. Okay, antiemetics. And antiemetic means treat or prevent vomiting or the feeling of vomiting, nausea, are known as antiemetics. Okay, perfect. So antiemetic, as I said, they treat or prevent vomiting or the feeling of vomiting, which is known as nausea. Okay, so we've got 4 fields. The first one is antihistamines, which are cinnarizine or cinnarizine. Cyclizine, very, very common. When in my ward I want to prescribe an antihistamine, okay, they prescribe anti-sickness, that is called, it's known as anti-sickness, they prescribe this one, the cyclizine. Then we have the dimenhydrinate, meclozine, repeat, meclozine, promethazine. Then we have another group called phenothiazines, and belonging to this group there are two medications called perfenazine or perfenazine, prochlorperazine or prochlorperazine, the same. Sorry guys. Then we have butyrofenones, which is the group, but there is only one medicine belonging to this group, haloperidol. So haloperidol, this one I'm sure we met it before, which was something to calm the crazy people, I'm sure, something like that. Sorry guys. Okay, and yes, it belongs to the antipsychotic drugs, yes. So this one is also here. So haloperidol can be used apparently as an anti-sickness, as an antiemetic, right? Then we have other drugs like betahistine, domperidone, granisetron, hyoscine, hybrodromide. So this one, hyoscine, hybrodromide, I've seen it. I have seen it. Metoclopramide or metoclopramide, nabilone, then ondansetron, tropisetron. So these are medication for, and they are antiemetics, so anti-sickness, anti-vomiting, okay, anti-nausea. Okay, so we're gonna read them again. Common drugs: antihistamines, cinnarizine, cyclizine, dimenhydrinate, meclozine, promethazine. Phenothiazines is the second group, sorry, and belonging to this group there are two medications, which are perfenazine, prochlorperazine, which is a antiemetic, anti-sickness, anti-nausea. Okay, then there is the third group, which is butyrofenone, and there is only haloperidol belonging. So haloperidol can be used as anti-sickness. Then other drugs: betahistine or betahistine, domperidone, which is for antiemetic as usual, granisetron, hyoscine, hyoscine hydrobromide, metoclopramide, nabilone, ondansetron, tropisetron, which are antiemetics. Then there is a second group, which is the respiratory system, okay, which I'm not gonna do today. I'm gonna do it in another. So there is a lot of groups, which I'm happy to do. I will do them all. I'm happy because I finally found a way to do this. Hopefully it's gonna work. Hopefully it is going to work. Okay guys, so please subscribe to the channel, like the video, and if you want you can comment saying how useful was this video for you. Thank you very much. Bye bye guys.